pleasure of speaking to you about long COVID, which by now I'm sure we've all heard about. Most people who have gotten COVID-19 do not become severely ill, and they get better. But what is equally as important is that some persons who have gotten COVID-19 have long-term problems after recovering from the original infection, even if they were not very ill in the first place. That means you can have a mild infection, never require hospitalization, and still go on to develop long COVID. So what exactly is long COVID? Well, long COVID refers to the signs and symptoms that develop during or following COVID-19 infection and which continue for more than 4 weeks and are not explained by an alternative diagnosis. It is sometimes called many other names, and these include post-COVID-19 syndrome, post-COVID-19 condition, post-acute sequelae of COVID-19 or PASC, or chronic COVID syndrome. You may have heard these patients referred to as COVID long haulers. So symptoms of long COVID are wide-ranging. We can see these on my slide, and these include extreme tiredness, shortness of breath, palpitations, fatigue, problems with memory and concentration, sometimes referred to as brain fog. Patients may continue to experience change in taste or smell, joint pain, and difficulty sleeping. The most reported symptoms are profound fatigue and breathlessness. And I need to stress on the word profound because our patients describe this fatigue as unlike anything they've ever experienced before. Long COVID presents differently in different people, and symptoms can occur in clusters or they can fluctuate over time. It often makes it hard for people to go about their daily lives or go to work for months or more after they've recovered from COVID-19, especially when these individuals find it hard to concentrate or remember things. So I wanted to share some experiences of our patients with long COVID with you for you to better understand the challenges that this unique group of patients face. May I have my second slide, please? So one patient described this as it's a constant cycle of disappointment, not just for you, but for those around you who really want you to recover. Another said some days it was a struggle to get out of the couch at all. One patient who developed lung disease explained, I was told that the scarring in my lungs will never go away. Another said, I worry I may not ever be able to work again. But what's important in patients with long COVID is how we care for these patients. And in managing long COVID, patients benefit from a holistic approach. Education is key for both physicians and patients to be firstly aware of this condition and secondly to be aware of what services are in place for the management and assessment of this sometimes challenging group of patients to manage. Firstly, people who have had probable or confirmed COVID-19 infection and their families or carers as appropriate should be given information on the most common, new and ongoing symptoms after acute COVID-19 infection. And they should be given realistic expectations of what they can find during their recovery period. Our recovered patients should be informed that recovery time is different for each patient. But for most people, most symptoms recover by 12 weeks. We should also emphasize to our patients that the likelihood of experiencing post-COVID condition or long COVID is not considered to be linked to severity of their acute COVID-19. So that is, they can have had mild infection, not require hospitalization, and still go on to develop post-COVID condition or long COVID. Patients should also be made aware that if they are worried about new, ongoing, or worsening symptoms, or if they are struggling to return to education, work, or other usual activities, especially if it's been more than 4 weeks since their initial COVID-19 infection, that they should contact their healthcare provider for assessment and further advice. Our patients with long COVID require multidisciplinary rehabilitation, and patients should be part of this development of a rehabilitation plan unique to each patient involved. And that should include physical, psychological, and psychiatric aspects of rehabilitation for our patients. So let's move on to discuss the care of long COVID within the North Central Regional Health Authority. So currently, there's the Executive Wellness Center, which is located at the Arima General Hospital of the North Central Regional Health Authority, and this provides specialist care for our patients with long COVID. This clinic was conceptualized by the NCRHA to meet the needs of our nation's patients following discharge with COVID-19 infection, many of whom have long COVID and need multidisciplinary management, which is the international standard of care for these patients. So this clinic takes place once weekly, and what happens is that patients present to the wellness center for a complete one-day assessment. So they have their relevant investigations guided by their presentation. They meet the relevant specialists who will guide their management, and this includes patients who have kidney disease, heart disease, lung disease, those requiring dietitian input, those who have ongoing social and psychiatric needs, as well as those who require physiotherapy and rehabilitation. Given the multitude of symptoms that we described with long COVID and long-term health consequences of COVID-19, as well as the extent of the pandemic, we know that large numbers of patients worldwide will experience long COVID and long-term complications of COVID-19. If you have recovered from COVID-19 and continue to experience ongoing symptoms such as the ones that we've described, I would encourage you to get in contact with your healthcare provider.